I don't get a lot of questions anymore about hip resurfacing, but it has come up a couple of times recently, and so I wanted to do a video to explain why I do not do hip resurfacing. This requires a little bit of some historical context. Hip resurfacing and the idea of it has been around for quite some time, even going back to the 1930s with some early attempts at hip replacement. Now, in the 1970s or early 80s, there was a prosthesis called the Theres, which was an early attempt at hip resurfacing with a plastic socket and a metal head. Those failed at an extremely high rate, and it was largely abandoned. About 10 years or so ago, there was a resurgence of interest because of the Birmingham hip, or the BHR hip resurfacing device. There was a similar product from Corin at the time, and so there was some renewed interest in this. And the concept behind that is that a resurfacing actually caps the femur, so it doesn't remove this portion of the femoral neck that we do with a more traditional hip replacement. Now, the biggest drawbacks with that were a couple of things. One, there was a high rate of femoral neck fractures with these. 4% in the lowest numbers in some of the series, going up to 10% or greater. So there were a lot of semi-catastrophic complications that required revision surgeries. The other problem was that these were a metal-on-metal bearing, so the issues with metal ion debris and soft tissue reactions were there, as well as concerns about leukemia and lymphoma and other possible consequences of metal ion debris. So for most surgeons, myself included, we've abandoned this concept of hip resurfacing. There are a few die-hard true believers that still do that in select patients. For most patients, a total hip replacement is overwhelmingly the better option with a ceramic on polyethylene bearing, as you see in this model. For some patients that have concerns about hip stability, we have options with a dual mobility prosthesis and some other ways to do that to help improve the stability. We also do all of our hip replacements robotically assisted at this point, so that we optimize the position of the implants to ensure that patients have a good result. But in my practice and in that of most hip specialists, we no longer do hip resurfacing.